Okay, we're here with Laura, my head nurse. This is Dr. Pano. We're going to give you the post-op indications for a hair transplant. Go ahead.
Number one, no restrictions on your diet after the surgery. You can go out and have whatever you like to eat. The only thing that you can't have is alcohol for the first 2 days. But this is because you're going to be taking antibiotics and it's not good to mix the two things together.
We also want not to have hard food like meat. We want soft food for the first day, most of all, because we don't want you chewing a lot. That's going to make more blood circulation on that area, so we don't want that either.
Number two, keep your head clean and dry, okay? If you have a little bit of bleeding, just get a clean tissue, wherever it is, gently press for a few seconds and then throw the tissue away. It should stop after a few seconds, so not to worry, and it's very rare that this would happen.
And if you have any accident that happens, you can come back to the hospital with us, to the clinic, and we can put back the grafts in if needed. We can check up.
Sure. For the first 3 nights, sleep slightly upright with a few pillows behind your back. This is because we don't want you to have any bleeding or any swelling, okay? It's just for the first 3 nights. Keep your head above your heart. That's the principal idea. Then take your medication as directed. You're going to be given 2 different things, an anti-inflammatory and an antibiotic. You just read the instructions as indicated by the doctor and take them accordingly until the course is finished.
Yeah, some patients need every 8 hours, some patients need every 12 hours to take the medication, but that's personalized, so we're going to need to tell you face to face.
For the first 3 days as well, it's very important when you leave the surgery to get a cool pack, a gel pack, okay, or a bag of peas in a towel, and you're going to put it over your forehead and your eyebrows. Don't put them on the grafts, okay, as often as you can remember for maybe 5 to 10 minutes for the first 3 days.
Yeah, we want your face cold very frequently, okay, so we want that to avoid any swelling at all to appear.
Don't comb or brush your hair or use any products like conditioner, hair gel over the first couple of weeks, okay, until all of the scabs have disappeared. Because if you get anything underneath that scab, it can irritate or maybe cause an infection, so just use your antiseptic shampoo as directed. Then, no direct sunlight on the grafts or saunas or anything like this for the first maybe 15 days, you think?
Or sometimes a month. This is personalized. Depends on how your little scabs disappear. Most of the scabs should disappear the first week, but we need to see you either through online or visiting us in our clinic.
Yeah, remember you can always give us a Skype call or a FaceTime if you have any concerns, or send a quick email and we'll reply as quickly as we can. The next thing would be relax for 3 days after the surgery. No physical exercise. You need to rest so you don't get any swelling or any pain.
Yeah, these first 3 days are the most important ones, okay? We need to stay in the hotel or stay at home, all right? We need to put a lot of ice. We need to take care of the grafts. We don't want any swelling, all right? But if you need anything, please call us or come back to the clinic. That's very important. And
then lastly, if you have FUT procedure, you're going to have stitches. Obviously, if you live far away from us, we can use absorbable stitches. Then they will disintegrate into the skin. How long, more or less?
3 months. It takes 3 months for those stitches to disappear. But the best option is to use normal nylon suture. That's the best option, and you can remove the stitches on your place, or as well you can come back up to us to take it out. Anyway, there are a lot of videos in my webpage teaching how to remove the stitches. So you can take that on your phone and show it to the nurse or doctor in your country, and they can remove it safely.
Exactly, and that's the post-op indications.
Post-op indications for hair transplant. Thank you very much.